Good morning, Chicago, and thank you so much for tuning in. Today is Tuesday, November 3, Election Day. Yes. Very exciting. If you haven't already voted, please make sure you get that done today. We are here, as always, to answer your COVID questions. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and we have a special guest with us today. This is Dr. Jennifer Suss. She's one of our medical directors at the Chicago Department of Public Health. She oversees what's called our MICA Bureau, Maternal, Infant, Child, and Adolescent Health. And of course, in the time of COVID, she's been part of the team looking at COVID in kids and in schools, but doing a lot of other things too. So do you just want to introduce yourself a little bit, let folks know what your background a little bit, what you've been doing historically, and then how things have changed with COVID?
Sure. So really happy to be here with Dr. Arwady. I'm Jennifer Suss again, and I'm the medical director for the Maternal, Infant, Child, and Adolescent Health Bureau at the Chicago Department of Public Health. I am a primary care physician by training. So like Dr. Arwady, I am a board certified internist and pediatrician. So I have the pleasure of taking care of kids and adults in my clinic. At the Chicago Department of Public Health, in my MICA Bureau work, I have been supporting our public health nursing programs, also our WIC program, which gives nutritional supports to moms and babies and families, our school-based health programs like our dental program, our school-based vision program, our school-based adolescent reproductive and sexual health program. And for COVID, I have had the pleasure of supporting our city's schools and daycares in making sure that they're a safe place during this time of COVID. And I've also had the pleasure of actually working with our city government departments. So have had the opportunity to work with many amazing people around the city who are keeping our city going, keeping our residents safe. So again, really happy to be here today.
Yeah, thanks. And she's been, I mean, everybody at CDPH has been busy, but Dr. Suss, between really this focus on pediatrics and all of our sister departments and sister agencies, a lot of work going on. So thank you. Yeah. Let's check our social distancing. So just as a reminder, this is one of the easiest ways that you can make sure you're keeping your 6-foot distance. If everybody is keeping a 2 arms length distance, that's important. And I think go ahead and start putting your questions, if you haven't already, into the box. You can put them right into Facebook. You can also, with a hashtag on either Facebook or Twitter, ask Dr. Arwady. And either of us will sort of take these questions as they come up. So let's start with a quick data overview. So we will pull up our dashboard. As a reminder, you can get there from chicago.gov/COVID. Chicago.gov/coronavirus is for all things coronavirus, and then chi.gov/COVID- will take you directly to the dashboard. So if we take a look, first of all, at the dashboard, you can see the numbers are continuing to go up. First, right up at the top here, our current positivity rate, that's our test positivity rate across the city, it is up to 9.5%. It was 7.6% a week ago. It has continued to rise. That is concerning because that increase is coming in the context of this second number here, where we are every single day breaking our record for testing in Chicago. So we've done cumulatively about almost 1.5 million tests here. If I look over on the daily real quickly, just for some context, that has, where we deduplicate, it's just loading. It's taking a second to load there, but it's been around 815,000, give or take, people. Come back while we're checking on that internet. And so the concern is that as we continue to break records on testing, now testing almost 13,000 people a day. If you look back, just as recently as mid-September, we were testing about 7,500 people a day. So really significant increases here. And in that context, though, our percent positivity is going up. And so the concern there is that, remember, test positivity is your number of positive tests divided by all the tests that you are doing. And so if all of this were being driven by an increase in testing, we would actually see, while the test numbers go up, the positivity rate go down. And that's not what we're seeing. Similarly, our confirmed case rate here, we're adding an average of 943 cases per day. You can see that's up from 809 a week ago, and our cumulative cases are just under 100,000. But I want to emphasize that as I mentioned last week when I was on here, there's been some work to really upgrade the data systems at the state, at Illinois Department of Public Health. And there has continued to be just some lag in terms of when we're receiving some of these cases. So the epidemiologists have figured out a workaround to this tonight, and we will be able to pull in some of those cases that have been delayed, but it means we're going to see a big surge in cases overnight here. And it's not that that's new overnight, but it's reflective of some of the ones that have been missing over the last few days. So I just don't want you to be surprised when you go and take a look that I do expect we'll see some pretty significant increase in numbers even beyond what we're seeing now. And that is because, of course, Illinois has been breaking records really day after day in terms of the number of cases that are being reported. Unfortunately, at the US level, that is also true. And I think, there we go, with some of the, this is now pulling back up. I wanted to just show you the graph here. So first of all, we've tested about 834,000 people. So about 1.5 million tests in about 834,000 people. We've had 3,067 deaths. You can see that our deaths are averaging about 4 per day right now, which is actually up just a little bit. We're keeping an eye on that. We're certainly seeing increases in hospitalizations and ICUs and starting to see some more patients on ventilators too. And the concern, of course, is that some increase in deaths will follow. So we've not seen a major spike there, but it is higher than we've seen actually in a number of weeks, and we're keeping a close eye. Certainly, this is nowhere where we were in terms of deaths. At the peak here back in May, we were seeing more than 50 deaths a day. But on the cases here, I just wanted to point out that we are just about up to the peak of where we were in terms of cases being diagnosed in the first surge. So in that context, really, really important that people are doubling down on the things that we know work. Do you want to comment anything about sort of data patterns overall and some of what we're seeing or what you're hearing?
Yeah, I mean, so we're seeing that there have been more cases reported to us from the schools and daycares.
Yep.
But we were expecting that because our community cases are rising. You know, we are hearing a lot of stories. So we're still really not seeing that it's because there was transmission of the virus within the schools and the daycares. It's the fun things that people are doing outside of school and daycare. And it's understandable. You know, it's fall time. People want to have those fall harvest parties, the Halloween parties. People are having sleepovers too. But right now, during COVID, it's not the time to do that. But we have seen a similar pattern in our schools and daycares.
Yeah, and I actually brought some of the data that we've been seeing. So do we have this up on the computer? Do you want to maybe go ahead and talk through some of this, or we can sort of do it together just to kind of give a sense of what we're seeing and explain the chart?
Yeah, so this is a graph that's showing the number of cases that have been reported in different youth settings over time. So the most prominent ones are the red and the blue bars. So the red section shows daycare cases. The blue bar shows school cases. And you can see that over time that we have seen a rise in the cases that have been reported in schools and daycares. More recently, so early on you see more of that red. That's because our daycares were operating, providing a really essential service to Chicago families so that parents could go to work. And then the blue starts taking over. That's when some of our private schools came back to in-person learning in August and September. And you can see that over the last few weeks that you're seeing a little bit more of that blue taking over, and it is in those the cases that we're seeing reported from school. Again, following the pattern of increased cases in our community overall, and we're still not seeing that there's much transmission happening within school or daycare. This chart here is actually showing a breakdown of whether the cases that were reported were in children or in staff. So on the left, you can see the daycare cases. On the right, you see the school. And you see that on the left, so pink is showing staff cases, blue is showing child cases. In daycares, it has been predominantly staff who are testing positive for COVID. Again, we are finding when we talk to the daycares and that when we talk to the staff members that the exposures are actually happening outside of daycare. They're having dinner with friends or they have a household member who has COVID. The graph on the right shows our school cases, and you can see that it's been predominantly in children, because again, that blue section is showing the children. So more cases in children that are being reported to the schools versus staff. More recently, we kind of saw an increase in the staff cases as well. Again, showing what we're seeing in the community, an overall rise in the cases. But again, the stories are, oh yes, I had dinner with a group of friends, or I had a play date with someone outside of school.
Yeah, let's talk through the rest of these and then I'll add a little bit of context.
Yep, and then this last graph here is showing the cases that have been reported overall that we know are in children in Chicago versus cases that we have had reported that are associated with a daycare or a school. So that's
basically it's like the last graphs in the context, like the red here are the graphs that we've just been looking at in the context of all the kids who are getting diagnosed.
Yes, that's right. And you can see that, so the red is showing the facility associated cases. It's a really small percentage or a really small number compared to our pediatric cases overall, which is a signal to us that again, those children who are attending daycare and school, they're not the ones who are driving the large number of cases that we're seeing in the community or even among other children in Chicago.
And what does facility associated mean?
Yeah, facility associated means that the child was in daycare or school during their contagious period. So they they were tested for COVID, they came out to be positive, or they had developed symptoms of COVID, and that they were in school or daycare within the 2 days before their symptoms started, or 2 days before they got their test if they never had symptoms. So again, that they could have potentially transmitted or been infectious while they were in school or daycare.
Mm-hmm. And then the last one here, I'll talk about this one. This is really looking at our COVID cases by age. And so in dark blue is the 0 to 17-year-olds. This is a graph we look at pretty frequently on here. You can get this right off the dashboard. But what you see is that in the same way that the red cases in the previous one were the pediatric cases we're seeing of kids who are in schools or are in daycares, this is then for 0 to 17-year-old kids. That increase that we're seeing is also sort of proportionate to the increase that we're seeing across the whole community. And so, certainly we've been getting a lot of questions in about schools, and I appreciate you coming on to share some more details related to this. Let's talk a little bit about some of what we have seen with where schools have been open, and what are we seeing now with increasing cases?
Yeah, so again, overall, our schools and daycares have done a remarkable job. Everyone has been working very hard to keep a safe environment for kids. I'm actually a daycare mom, and I feel very comfortable sending my kids every day to their daycare because I know that they have implemented some very important key preventive measures. So, for example, all of the staff are masking at my kids' daycare, and all of the kids who are 2 and over are masking as well, my son included. Learn how to put on a mask. It actually wasn't as hard as I thought it would be. They are maintaining physical distancing, that social distancing whenever possible. So we know that for infants and toddlers, it might not be possible in terms of the learning environment, but the staff, every time they can, they are maintaining that distancing. When I walk into daycare, there are marks, so I know where to stand, so I'm not close to anyone else. They are making sure that the staff are all washing their hands frequently, and that the kids even the infants, they're washing the infants' hands, so really good hand hygiene, and making sure that they are also cleaning the facility, the school and the daycare, and going through and cleaning those high-touch surfaces frequently throughout the day. And then I think the other thing that we have been really impressed with is that if a family or a staff member reports to them that, hey, I tested positive for COVID, they go into action immediately. They make sure that they identify who needs to quarantine, who's been a close contact, to get that notification out, and to work with us at the Chicago Department of Public Health to make sure that they are sending all of the appropriate staff members and students who may have been exposed home to prevent the risk of anyone else at the school getting COVID. So it's been really impressive.
Yeah, and we've got a couple kids here, questions here. Jimmy Capello on Facebook is wondering, why are Catholic school kids at school? Anna Stansfield on Facebook is saying, how can you confidently say schools are generally not the source of COVID spread? Maybe I'll start with the Catholic piece, and then we'll talk a little bit about this. So, what's been really interesting here in Chicago is that we've had an instance where our public school has continued with virtual education, but our private schools and our parochial schools, including the Archdiocese, have been open for in-person education with the same amount of community spread around us. And so it's actually offered an opportunity for us to do some comparison and sort of look at what is the risk, what does this look like. And people, may remember when we were talking about this a few weeks ago, we had looked at the data from the Archdiocese schools, and this is, I think it's the biggest private school system in the country, and where we just look at the kids in school in Chicago, they've had about 20,000 students in person, had about 2,700 staff, and where we had compared from when they had opened at the beginning of the school year through early October, absolutely there had been cases in schools, because there will be cases, and as there are increasingly more cases in the community, people are getting infected and coming into schools. But the question is, how often do you then see spread within schools? And so, where I think back to early October, I think there were 31 schools, like even just from within the Archdiocese, that had reported, yes, there has been a school-associated case, but the great majority of the time, it was actually just one case being reported, right? A case comes in, you have to do the case investigation, you have to quarantine, you have to send pods home. It's a lot of work, it's a lot of operational burden, but we didn't end up seeing significant additional spread. And even where there were multiple cases, most of the time it would be because there were 2 children in school who were siblings, for example, or there had been other kind of exposures outside of school. And really, the number of times that we were not able to rule out spread within the school was really sort of less than a handful of times. It doesn't mean that it is not impossible for this to happen, of course, but what we've seen is that in the private schools, in the parochial schools, and in the daycares, by and large, that have been open here, where people follow these protocols rigorously, we actually are not seeing an increased risk for COVID for the kids or for the staff that are in these schools. So where we compared kids who were in school in the Archdiocese in particular, the rate of COVID for those kids was about half the rate of COVID for kids who were not in school. And again, this just recognizes that children are interacting in other ways outside of school, and there may actually be less adherence to masking and protocols and other things in that setting.
Right. No, that's absolutely right. And to the question of how can we be so confident, we talked to the daycares, we talked to the schools, we talked to the people who have tested positive for COVID, and almost in the vast majority of cases, the person who was positive could actually identify where they were exposed, and it was not at daycare or school. Again, my friend tested positive for COVID, I just had dinner with them. So that's how we are fairly confident that, again, that school has not been the place where the transmission and the increased cases are happening.
And I think, for me, this has been one of the more one of the things that has surprised me about COVID all the way along this has been just how differently it's behaved in children compared to older people. It's different, most of the viruses, as you know, we tend to see them hit young children very hard and older people very hard. This one has not had as much of an impact on young kids. And then similarly, we really, where we were looking at this back in the summer, there was an expectation that schools would probably be a big source of spread. And we really were not feeling not feeling as confident about being able to have schools open where there was a lot of community spread going. But what we've seen is that places all over the country and all over the world, but especially all over the country, went ahead and reopened schools, even in places that were having much worse outbreaks than we were having here. And by and large, it actually went well. And we didn't end up seeing the risk of spread because, again, we've learned a lot about in settings where you have regulations and they're followed. It's not a completely normal experience here. When a case comes in, there's a lot of work that has to be done. You will need to send kids home potentially. But to me, it's been one of the more sort of surprising things.
Yeah. But I think it's also a testament to the preventive
Yes.
measures that we have been asking everyone to do, that they really do work.
Yes.
Because schools and daycares are making sure that everyone is doing those preventive measures.
Yeah, and here's a follow-on. Anna Stansfield is asking, can you please give an example of a school district in the world where reopenings have not been followed by a rise in infections? And in fact, like, not just one example, but there's been lots of examples from around the world and around the US where reopenings have not been followed. There's a recent study just came out, people may have heard it covered on NPR and others, from Insights in Education, that really looked at this internationally, and found that at this point, because of what we've learned in this setting, almost all countries, they've looked at 191 countries, 89% of the countries that are in a second COVID wave are opened to students this time. Only 9%, only 4 of the 45 that are having a second wave are keeping schools closed because we've learned, first of all, that this is, we already know how essential it is. Education is sort of an essential, but also that these were not seen to be the risk factor. So if you look at Ireland, for example, right now, they have a very strict, full lockdown in place. You can't go 5 kilometers from your home, but schools are open. The UK, lots of places have recognized that the risk was just not as high as we had thought it would potentially would be. And so schools have moved into that essential category. And if you've got all the right mitigation in place, now certainly if you're seeing significant spread within a school or there's a lot of introduction, you may need to close an individual school for some period. That's what we're seeing Japan doing, for example. They're not setting, here's a metric at the country level or at the regional level where we would make a decision. Instead, it's on a school by school basis. France is doing something similar. But the story really has changed around what we think the risk is in these settings. So
no, absolutely. It's really heartening. I mean, it's really great to see this because education is so important for our children. It's a place for them to go to learn, but also a safe place for them to be while families are working. So it's been really wonderful to see this really encouraging data.
Yeah, and I know it's it's a hard decision for people, right? We recognize that it's all about risk mitigation. There is no such thing as a completely risk-free environment from COVID wherever 2 people are interacting, but especially where we're thinking about the youngest kids, the kids with special needs who have trouble, honestly, sort of learning through screens. I think, where we've been able to bring some of those highest risk kids back, I think it's been really important. And frankly, I don't like thinking about a society where people who have the funds to be able to pay for education can get their kids educated and the others can't. So that's been some of the conversation. Jennifer Jones here on Facebook is sort of saying, how can it be safe for kids to be in school buildings with cases increasing like this? And then specifically she says, preschoolers don't understand 6 feet apart. How do you mitigate the damage to social emotional development or not make the experience traumatic? I think that's a really good question in framing.
Yeah, no, that is a great question. For the preschoolers, schools are the experts on how to best educate the kids. Physical distancing during this time of COVID is part of that education, but we know that distancing is not going to always be possible because of what they need to teach and what the kids need to learn. So this is where, preschoolers, they're over 2 years old, so they can wear a mask. So they wear a mask in school. The teachers are doing a really important job of making that kind of a normal part of the kids' day too. And they're able to give that social interaction when they're in person, which I think is so important. You're able to interact with others in your classroom. So it's not purely for social that's an important part of it too, but it's part of the education of a young child. Absolutely, physical distancing is hard to maintain for younger kids, but it's part of that, I have to remind my kid, listen to Dr. Arwady, sing happy birthday twice when you wash your hands. It's these constant reminders, and it's part of the whole process. But again, the teachers are also doing everything they can to make that safe environment, wearing masks themselves, physically distancing whenever they can, hand hygiene.
Yeah, and I think what's been interesting, and a lot of people are chiming in on this, around Heather Hall on Facebook, can preschool children effectively follow these guidelines? How can parents be sure CPS is following CDC regulations? For what's been very interesting for me is actually seeing this happen. I think people really have trouble imagining that young children in particular are able to do some of this. But young children, follow the model that is set for them. Like really in some ways, and what I've seen, I can speak to, for example, my nephews are in school in person in the greater Chicago area, and one's in kindergarten, and like those kids, they're sitting, they're separate, they're wearing their masks, they know how to separate at lunchtime, they know how to do this. Like it takes actually seeing this to happen, I think, for people to, and then some of the parents who had opted out are actually seeing in person, they're seeing on the Zoom that there are kids who are able to do this, and there's more interest in bringing kids back in. I do feel strongly that making sure, people are going to make different decisions around this, but we really have seen it. And the other thing is with these youngest kids, I was really reassured because there's also the staff, right? And this is the other piece. There was this big study in pediatrics, which is the main journal of the American Academy of Pediatrics. It's kind of the leading journal for pediatric medicine. And earlier this month, they came out with a study, really a survey of 57,000 childcare. So these are the younger. Again, these are sort of the pre-K, including spaces where the youngest, you can't socially distance. These would be potentially more of a risk. And they surveyed more than 57,000 childcare centers across all 50 states. And they actually found that providing direct care to children in these childcare centers was not associated with a higher COVID risk among the staff who were watching the children all day. Again, a testament to people being very careful and aware. And I remain very convinced that the best, like where we get in trouble with COVID is where people let their guard down against COVID. Like this is what we're seeing over and over again. That's why the homes, et cetera, have been such a concern. And when people are in settings where they are paying good attention to protocols, the risk is not zero, it can't be zero, but seeing some large studies like this have been very reassuring to me.
Yes, and I mean, this is what we're seeing in Chicago too in terms of the risk to staff who have been going to daycare and school. But I mean, again, this is, our teachers and educators are amazing people, and they are the experts here. And like Dr. Arwady said, what I've witnessed in my own kid and what he is able to do now in terms of physically distancing, sitting still, staying away from others when we're going out, putting on that mask, it really is remarkable. So again, thank you to our teachers and educators out there for doing that. This is such an important part of learning for a young child, for all of us, because COVID is so new.
Yeah, absolutely. All right, let's hit on a couple of other topics real quickly. Denise Sims on Facebook is asking, do you think women should go get their annual mammogram in 2021? I have concerns about ventilation. So my recommendation always is you should be in conversation with your doctor about this. But if your doctor is recommending that you get your preventive, especially cancer screenings, you should be getting those. You should be getting your skin cancer screenings, you should be getting your mammograms, you should be getting your colon cancer screenings, your kids should be getting, and you should be getting your vaccinations, and generally making sure, we've, again, in terms of learning about spaces, healthcare settings have learned a lot about how to keep spaces relatively safe. Really very, I don't have a major concern there. So have a conversation with your doctor, certainly, but I would strongly recommend doing the important things that help keep us healthy. We talk a lot about the indirect effects of COVID, and sort of in the same way with the school conversation, there is the indirect effect of kids not being in school and getting educated. What does that look like? What does that look like for equity and education in a long-term way? That's an indirect effect. In the same way for COVID, if we see people not getting medical care that they really should get, and we end up seeing surges in cervical cancer or colon cancer or breast cancer being detected later, that would be an indirect effect of COVID. So have the conversation with your doctor, but broadly, I would recommend getting.
Absolutely. Agree. I'm going to get my mammogram.
Yep.
Early next year, yep.
Absolutely. Okay, so a couple questions here about numbers and dashboards. So Donna Brown on Facebook is asking, what's the best place to look for the most accurate numbers on COVID? Brandon on Twitter is asking, any idea when the weekly dashboard will be fixed? And so this is on, these are both kind of related to the dashboard. So I would absolutely continue for Chicago numbers, if that's what you're interested in. The dashboard, chi.gov/COVID- is your best place to go for the most accurate numbers for Chicago. We do update the whole thing every single day. today. Where there are, like I was talking, there are some delays in terms of the cases coming in. We work to get those fixed just as quickly as they can. And in terms of sort of fixing the weekly dashboard, this is around making sure that the weekly dashboard is reflecting the test positivity, which is what the state is using for mitigation. So for example, when we're over that 8% positivity, that is the setting in which, for example, the indoor restaurants are closed. And we wanted to make sure that people were able to see how that test positivity matched up to their neighborhood. And so that is also, I don't have like I saw the mock-up for it over the weekend. My hope is perhaps even with the big refresh, with being able to pull in some of this extra data, that'll be there, potentially even tomorrow. I never want to promise on behalf of the IT people because we have to make sure it's straight. But for Chicago data, that is where I would continue to refer you. The Illinois Department of Public Health website always has the state level data. It generally has less of the deduplication and sort of the details around individual level person positivity, this kind of thing. And then your local health department page would probably have additional, depending where you are, if you're outside Chicago. But if you're in Chicago, please do keep using the website. And the other, we're getting all kinds of exciting updates with pulling in hospital data, like lots of other things. So we are really working hard to continue to add the data that people are most interested in. But all of that is available right now. It's just you need to look for it a little bit more. We want to make it easy. Okay. So Ike Saunders on Facebook is asking, what's the difference between a rapid antigen test and a PCR test? Should one be trusted over the other? Do you want to maybe start on that?
Yeah, absolutely. So the PCR test, which is the one that people have probably heard about the longest, it's looking for the virus's genetic material. The one that, the swab in the nose, looking for that genetic material, that's considered the gold standard, the one that we think is the best test out there to pick up the virus. A rapid antigen test, so an antigen, it's looking for the virus's protein, so not the genetic material. But the advantage is these tests will give you results within 15 minutes or so. They're not as good at picking up the virus. Again, the advantage is if you're positive, you got your result within 15 minutes. You have to go isolate. You have to figure out who
a positive is very good. In a setting where there's a lot of COVID, you get a positive on a rapid antigen. We consider that a positive, not a concern.
That's right. Yeah. If you are negative, though, and you have symptoms of COVID, you've been exposed, then you should be getting that PCR test to confirm that you truly are negative.
Exactly. Yeah. And sort of at the highest level, we think of those PCRs, like just in my head, here's how I kind of think about it. They remain the gold standard. And I see he put in a question about sort of anterior, and there has been progress in those too, in terms of not needing to do the very, very deep nasopharyngeal swabs where you go very, very deep into the nose. We're now able to do more of these, PCR tests just with swabs either in the mouth or sort of just in the part of the nose that isn't stuck in deep. So, the testing continues to evolve. But those are sort of in the high 90 percentile in terms of sort of how, quote, accurate they are, sensitive and specific. The biggest thing that makes you have a false positive or a false negative, particularly a false negative, is if you test too early, right? If it's not built up yet in your body. This is why, again, you cannot test out of a quarantine. If you have had a true exposure to someone who has had COVID and you are told that you have to quarantine for 14 days, you have to quarantine for 14 days. It does not matter if you get a negative test because your test can turn positive for as long as 14 days after, because it can take that long for the virus to build up. The antigen test, the rapid antigen tests, really pretty brand new to us. The health department just received our first batch last week. They're very good for people who are symptomatic. If they're positive, they're good. It's just that we would want to use sort of the gold standard test. They're still in the 90% plus sort of accurate sensitivity and specificity. It's just that they're more in kind of the low 90th percentile. But there's a lot of value in getting a test report back quickly, and it's more that you would just want to have the follow-up if there was a significant concern.
That's right.
All right, we are just about out of time here. This has been a very quick call. I'm going to take one more here from Allie A on Twitter, who's got a question about data lining up. And she says, if you say 2/3 of the people know who they probably got COVID from, how does that make sense if 3/4 of those people are in their home? So let me sort of talk through that again, because I think it's an important point for people to understand. So when we are doing case investigation and contact tracing, we are reaching out to people who have been confirmed to have COVID. The health department receives, again, the reports of anybody with a positive COVID test. And reminder, that has to have the appropriate contact information. If we don't have a good phone number, we don't have this, we can't always reach those person. If there is too long of a delay in terms of us receiving the test result, either the test takes a long time or there's problems behind the scenes, we can't sort of reach out to everybody. And then when we do reach out, as we've talked about, we don't reach everybody. So there are plenty of people who don't pick up the phone, or who, even if they do pick up the phone, they don't want to participate. And so this is not 100% of people. I think it's important that people are understanding that. And we showed, if you're interested, just last week, we showed some of our data here around what that looks like. But among the people with whom we do an interview, one of the most important questions we ask is, do you know that you've had a COVID exposure? Like, do you have a guess, basically, of where you might have gotten COVID? And 2/3 of the time, people actually know who they probably got COVID from. And 1/3 of the time, they don't know. And so when they don't know, they could have been out, they could have been around. We don't always know. We do some work behind the scenes. But when people have a pretty good guess of where they've gotten it, they're usually right, to be honest. And often we then ask, if you know who you probably got COVID with, we ask, where was that exposure? Was that exposure in a work setting? Was it in friends? Was it with family? Was it with extended family? Was it with neighbors? Whatever. And 3/4 of the time, the people who say, yeah, I have a pretty good sense of where I got COVID, 3/4 of the time across the city, they're telling us where that exposure was in a private home. Because again, this is where people let down their guard. So does that make sense? It's not that, it's based on sort of the interviews that we have done, but we know, and that's part of why we made these strong recommendations that right now, with the amount of COVID that is here, you should not be having people over into your home who do not live there, unless there is an essential reason, like home health care, like child care, like education. And if anybody is coming into your home for one of these essential type reasons, you should really be having them wear a mask, even within the home, and being careful about social distancing and hand washing. It's not that there is not risk in other settings, but our own data just shows us, and we see this in our investigations too, that it is where people are getting together, that is where we're seeing a lot of spread. And it's some of the hardest, I think, for our case investigators to deal with, because you're talking to people who, you know, not only are they dealing themselves with a COVID diagnosis, but often there's concerns about, you know, people who they love, who they may have had close contact with. Yeah. So anything else you wanted to add? Thank you again. This is Dr. Jennifer Saw. If you missed the beginning, she's one of our wonderful medical directors at the Chicago Department of Public Health, leads our Maternal, Infant, Child, Adolescent Health Bureau, and has been one of our lead people working on schools. You're going to hear a lot more, certainly in the weeks to come, as we keep talking about schools and the essential nature that schools play. But it's been one of the spaces where the data has just shifted a lot over the last few months, but in a good way. So anything else you wanted to add or feel like we didn't touch on, or things you want people to hear or do?
No, it just was my pleasure to be here today. I have been so proud to be a Chicago resident, because our city has done a remarkable job in responding to COVID-19. So it's thanks to everyone, and special shout out again to all of the teachers and educators out there. Thank you to my kids' teachers, because I have been so grateful for the safe environment and all of the important things that you're teaching my kids.
Yeah, absolutely. And I would just echo that. Like, where we think about sort of our essential workers, you know, I do think about our educators absolutely in that group. And whether these are people who have been teaching remotely, whether these are people who have been teaching in person, this has been an extremely challenging year for everybody around education. And, you know, the work and really recognizing that we've got to make sure we're not leaving kids behind, and doing everything we can from an equity perspective to make sure that whether you're getting a good education is as little as possible, dependent on your family's income. So I echo that thanks. And if you've got other questions, send them in. I'm sure we'll have more conversations. I wanted to just end on two things to do. One is that we still absolutely need you to get a flu shot if you've not done that. Everybody over the age of 6 months, with very few exceptions, should be getting a flu shot every year. You can go to chai.gov/flu to see where you can get free flu shots. We've got about a week and a half left of the free Chicago Department of Public Health flu clinics. And so if you've not gotten in, this is a good time to be doing it. If you don't get it into one of the CDPH clinics, you can get it through your provider, you can get it through your pharmacy. The sooner you get it, the better, because it takes about 2 weeks for that protection to kick in, and we are starting to see flu season kind of ramp up. But the last thing that I would say in terms of things to do is please make sure you vote. We are all very focused on what this election is going to show. And from a COVID perspective, regardless of the outcome, I am most interested in making sure that we have truthful statements about COVID coming out of the federal government and out of the White House, and that we can collectively work on what is going to be a difficult winter from a COVID perspective here in Chicago and across the country. I encourage everybody to make sure you get your vote in today. And I think with that, we will be back on Thursday. On Thursday at normal time, 11 a.m. Put in your questions in the meantime, and we'll talk to you then. Thanks.